her little brother and sister. Lady will be having stem cells in a couple of weeks. She has Lady she has severe arthritis in her hips and stifles. Good job. This is Lady Bender. Been doing acupuncture, chiropractic, and underwater treadmill for about 2 months now? 2.5 months.
This is Lady. She's getting ready for her procedure this morning. We already placed her IV catheter so that way anesthesia can go smoothly and she can get fluids. We did draw some blood work this morning and do a preoperative ECG. Everything is good and within normal limits, so we're getting her sedated very soon.
This is Lady, and she's just getting some anesthetic here. She's been pre-medicated, so we can see she's pretty happy already. And she's here for stem cell therapy today. She's got very, very bad arthritis in both of her hips and some arthritis in her left knee as well. So the first part of the stem cell process is collecting the cells, and the cells are found in fat tissue. So right now she's being intubated so we can give her anesthetic and oxygen. And then after this, we'll do a minor surgical procedure to get her fat cells, process those cells over a couple hours, and then inject the joints that need it, which are her hips and her left knee. So here, Lady's on the table and is getting the oxygen and the anesthetic, and you can hear the monitors in the background. We're just draping her here to get ready to make an incision and get the fat sample. These blue drapes are just for sterility purposes, to keep things sterile during the procedure. Okay, here's her sample. So Lady, we're just suturing her skin closed here, and she'll be waking up shortly, and then in about 2 hours or so we'll go ahead and be able to inject her joints once the stem cells have been processed.
Mixing up, what that does helps break down the fat to get the stem cells. Inside the specialized hood, she's going to be mixing that and then adding it into the two separate fat samples. This little bottle here is the enzyme that you use to break up the fat. Marianne's about to mix it. She's going to dispense the enzyme through a filter. Helps take away any of the debris. So our fat cells are actually done incubating. The enzyme has done a lot of work to break up those fat cells. And now we're going to put them in the centrifuge and spin them down.
So with Lady, we got 47.4 million stem cells out of the fat that we extracted, and we divided that into actually 5 injections, one for each of the knees, one for each of the hips, and then one intravenous injection. With the rationale of the intravenous injection is that the stem cells will go to where the body needs them the most. On the same day, she actually had her left knee had surgery. We did a TTA on her left knee as well, so she had a full day that day.
Okay, Lady wants to jump in the pool.
This is Lady Bender.
Okay, Lady.
Another treadmill.
She's in water aerobics.
Mommy's keeping her employed.
Okay, Lady girl.